Hey everybody, it's Dr. Brett Brimhall here. I'm excited to share with you guys some information that I've been reading and studying about and actually seeing in my clinical practice when it comes to what's called COVID long haulers. So as I do this, I want to share a couple of studies that are currently going on out there over the last few years and things that you can do for you or maybe some of your family members that are struggling right now with this. So let me share my screen so you can kind of see some of the slides that I have, and then you can have this for reference if you want later on. Okay. So what we're seeing right now is that there's some studies being done looking at the effects that COVID has been having on people for what they call long haulers. So anything that's people that are having symptoms, 6 to 12 weeks past and then ongoing. So these are all pulled off a place called what's called PubMed.gov. So you can pull them up later if you want. You can go in there, type in COVID long haulers or something like that, and you can find these studies. Here's a couple of them specifically. Though the red, the predominant symptoms that they're seeing with what they are considering long haulers are fatigue, breathlessness, can't breathe, arthralgia, which is like joints hurting or pain, sleep difficulties, and chest pain. So they're seeing also now some things related to the skin, the cutaneous, respiratory, cardiovascular, musculoskeletal system, mental health, neurological, and even renal involvement. They've looked at kind of condensing all those. They've listed the top 5 symptoms that they're seeing, and this is what they're saying. They said estimate that 80% of the infected patients with SARS developed one or more of these long-term symptoms. So they're considering long-term 6 weeks past. And some of these have been going on, maybe you know some people that have literally gone on for over a year now. 5 most common are fatigue, headaches, attention disorder, hair loss, and dyspnea or difficulty breathing. All right, and they're wanting to focus on what do we need to do to see if we can get people back on track. So here's just a picture kind of showing some of the things you're seeing. So literally it's why is it affecting and giving people these symptoms that where it's a whole bunch of different systems across multiple systems, not just one. Well, and it's kind of interesting. This has been in the media a lot. This is actually just, I pulled up today on AARP talking about COVID specifically and hair loss. So how do all of these things intertwine? Well, here's kind of the process of hair growth, just so you can see. Typically in the past, we look for nutritional deficiencies, hormone imbalances are common. A lot of times people will use like some DHT blockers, basically help the dihydrogenation testosterone to help block the wrong hormones that cause hair loss. Trace minerals like selenium, zinc, iron, like there's lots of iron and anemia that will cause hair loss. And there's other vitamins, minerals, amino acids like collagen, biotin, different what's called orthosalicylic acid that the body needs to manufacture hair. All right, but it's bigger than that, right? So you can talk, like most people in science, we talk about following algorithms to like, hey, if you have this, it means this. Well, we're going to talk differently in understanding there's a process that's going on here inside the body that needs to be addressed in order to have long-term solutions. So this is some of the things that I've been noticing in my clinical practice, where a lot of the symptoms that we're having look very similar to what we see with chronic fatigue and fibromyalgia. So here's a study showing that. It says they're talking about the role of mitochondria. So if you're not familiar with mitochondria, that's the energy producers of your body, okay? Oxidative stress, that's like aging. So that's rusting. So like metal, when it ages or gets wet, it rusts. And the response to antioxidants in this myalgic encephalitis or what's called chronic fatigue syndrome, right? So this is what the study kind of highlights. It said a significant number of the SARS pandemic patients have developed chronic symptoms lasting weeks or months that are similar to chronic fatigue. So it looks very similar. I've noticed this in my practice as well. So they're talking, they're looking at the literature and understand the role that the mitochondria, so the energy production, oxidative stress, and antioxidants may play in understanding the pathophysiology. So the pathophysiology just means the process that's going wrong. All right. So they're looking at what's called dysfunctional pathways. So think of this as systems. So the systems are breaking down. So think about just in your office or where you work, or even just traffic flow. So like when you're driving, trying to get from one place to another, we always say the shortest difference between 2 points is a straight line. Well, especially with no traffic. So in the body, there's a bunch of different systems that are supposed to work together for us to feel our best. And some of those key systems are the repair system, that'd be the oxidative stress system, the energy production system known as the mitochondrial system. If you don't have energy and your body can't repair it, it's really tough for anything really to work. So they're going to talk about the mitochondria and the oxidative stress response, and that's what I'm going to come back to that, because it's important to address the major systems overall, because that's what, for years people were saying, well, chronic fatigue is not a thing. Well, it is, but they couldn't pinpoint a particular cause and effect. But what it is, there's different systems that weren't working optimally, which led to people being tired. And there's two types of tired. There's brain tired and there's body tired. And you need to address each one in the right way. So, so going back to, we're going to work on the systems, right? And then we'll talk about individual things specifically to hair loss, because that's what people have been asking me a lot about, is in order for the body system to work right, they need to have a healthy, normal immune response. And that has to involve what's known as the microbiome. So the digestive tract, but also includes the mucous membranes in your mouth and nose and all the way down the digestive tract. So here's some interesting things. They're talking about the interventions to support a healthy immune response, all right, through diet, nutrition, lifestyle approaches, all right? Talking about colorful vegetables, fermented prebiotics, anti-inflammatory, antioxidant, phytonutrients. And at the summary at the bottom, this review suggests associates between airway and intestinal microbiota, antiviral host immunity, and the influences of dietary, nutritional, and lifestyle interventions to prevent the clinical course towards severe COVID. So if somebody's struggling to get well like they were before they had the infection, no matter what it might be, that means that systems are still struggling, right? So we need to address the systems that are struggling in order to have a different outcome. So this is kind of the foundation of why many people don't get well. So the gut function is critical. So you think about the digestive system, they call it the microbiome. Its job is to take in food, break it down, and then create energy from it. Its also job is to keep things out that the body does not want in, right? And so think of it as your first line of defense. So so if you, this is kind of a picture description of the intestinal wall, and in the wall, there's our frontline army. There's part of them is the prebiotics, excuse me, the probiotics. These are the good bacteria that are supposed to be there. When they are there, you have a healthy intestinal wall. So basically think of having good doors and windows in your houses. Things can't get in that aren't supposed to get in, right? And it helps produce natural antibodies to keep the other bacteria and things that aren't supposed to be there away. All right. It helps to normalize your pH, which we always is critical, because without the exactly right pH in the body, food's not broken down. Enzyme processes don't place. Things grow that you don't want to grow. So it's critical that that pH is controlled. It's critical for your brain to work right. It also synthesizes your B vitamins. It breaks down those bad guys, and it assists in digestion. But also, when the digestive system's healthy, it helps your body produce things you need. For instance, one of them being serotonin. Serotonin is what we call the happy hormone. So if your body's digestive tract is not working well, it's super hard to produce serotonin, where you feel good mentally. On top of that, your body can't produce an enzyme known as diamine oxidase, which helps break down histamines. So many people have a lot of allergies or histamine-rich foods, can't handle them. It's because of this dysfunctional digestive tract. So what happens with many people, dysfunctional digestive tract, and this can happen from stress, it can happen from antibiotics, it can happen from poor foods, inadequate diet, where there basically become imbalance in the garden, right? So if you don't have enough of the prebiotics, which is like the fertilizer, the right things for the things to grow, the right probiotics, which is like the seeds, which is the good bacteria, it can't produce the things that allow your body to function ideally, which is called a postbiotic, right? So when that happens, it's called leaky gut syndrome. Now, why are we talking about this in relation to hair? Because all of this matters. Because if you were going to talk about the nutrients that are critical for hair or anything else, right? If your body can't break it down or absorb it, it's really not going to help the way it could. So it's critical we address these underlying systems. Right? So there's a process that leads to disease, and it doesn't start with disease. So it starts with susceptibility, and then it's called pre-pathogenics. Well, this is most people are. And then you get pre-symptomatic, where there may be stuff going on in there you don't necessarily feel. And then there's clinical disease, where you start feeling symptoms, or you start seeing things show up, right? And then there's eventually disability and death. There's kind of a picture of what that means. So how susceptible are you, or how healthy are you? So the absence of symptoms does not mean healthy, right? So I want to broaden your definition of health a little bit. So health, according to the World Health Organization, is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So my question to you is, when was the last time you felt relaxed, where you felt calm, where you went to bed super easily, you woke up rested and ready for the day, right? That is the definition of health, where you have abundant energy. Because if you don't have abundant energy or feel abundantly healthy, you can't do the things you love. So here's kind of a visual and maybe some words that would help describe that differently. Do you feel driven? Do you feel dragging? Do you feel like you're losing it, hitting wall, or burnout? So this is the process, not just related to adrenal, but whole body, right? Is where do you feel in this continuum is telling you maybe how much reserves you have. Many people are on this journey, and most of us don't do anything until we have a symptom. We need to change that. Now let's work toward having optimal health. And it's just like it's a process to lose your health, it's a process to regain your health. So the goal is to keep it super simple, is to fill your tank up and decrease the things that drain it. If we can do that, we can keep your tank full and your body can have reserves built up to repair. So if there's not enough money for the month, we have to reduce our spending, all right? Which your body's way of doing that is to make you tired or to get rid of tissue that's not necessary. So when it comes to hair, it's not needed for life. All right. So your body will always protect, critical organs and glands before it protects others because it wants to survive. So it's critical that we move our bodies in this place where it can be able to give it what it needs. So we build the tank up so it can start fixing what it needs to, and then it can focus on what you may want it to fix. All right. So let's kind of summarize when it comes to hair, specifically what you need. It's in order for your body to make hair, right? In order to keep your hair, you have to have certain key things like essential fatty acids. So that comes from your foods. They can go animal-based and plant-based. You have to have those to have healthy hair. You have to have your B vitamins, your B6. We hear a lot about biotin, that's B7, B12, folic acid. Those are critical. And what you have to keep in mind, some vegetarians or vegans might have a hard time getting those from a diet because they're more rich in some of the animal-based, some of the B12s. All right. You can get B6 in like bananas and potatoes, and then B12 in the meat and fish, poultry stuff. You have to have adequate protein in order to make hair. So collagen is a type of protein. You hear a fair amount about that. You can get that from other sources, but you need collagen to make hair. And then you also need trace minerals like iron, magnesium, zinc. All right. So if you don't have iron, they have anemia, it's very common for people to lose hair. So these are the nutrients that you need in order for your body to make hair, right? So it's all good if you to have that, but if you can't absorb it, that's a problem. So here's kind of a summary. If you're struggling with hair loss or some of these other symptoms that are post-COVID, address the systems, not the symptoms. So that's going to be critical thing. One, put your body back in a state where you're resting, you're repairing, and you're rejuvenating and decreasing the stressors that are going on inside your body, all right, or the outside influences, all right? So one, reduce the oxidative stress, right? So what that means is you want to put the right nutrients in and decrease the stressors where you can. You want to improve your mitochondrial function. So basically improve repair, increase energy production, because all of that, if you look at the major symptoms related to the long haulers, like headaches and focus is more of a neurological symptom, right? Difficulty breathing would be more of a lung-based symptom. Hair loss would be more of a nutritional symptom. So you're seeing across the board multiple systems involved because we have too much oxidative stress, body can't repair as fast, not enough energy production, so not enough of the mitochondrial function going on, and we have a dysfunctional immune system, which we now know is in the intestinal tract, which relates to a microbiome that's dysfunctional. So in my practice, what I would work with my family is to give the body what it needs when it comes to diet, nutrition, exercise, and sleep. Make sure we support the intestinal tract with prebiotics, probiotics, and postbiotics. Make sure that I'm addressing the key cellular switches that control oxidative stress by helping the body produce big enzymes like glutathione, catalase, superoxide dismutase. Right? Make sure we're making sure we're addressing the mitochondrial dysfunction, which that means helping your body give what it needs to make good energy. So we can do that both through nutrigenomics, with basically activating that pathway and then giving the mitochondria what they need. Now, which one's most important? all of them, right? But if I'm going to start with a foundation, make sure you get that gut healthy so that when you take the other nutrients, your body can actually absorb them and utilize them the most effective. So please pass this on to those that you love and care about. If you like what you saw, just like it. If you have other questions, let me know. And I'll do other videos that may be more specific to things that are going on in your guys' family. All right. Have a great day.